While investigators are not yet disclosing all the circumstances of how a baby's body ended up left on the side of a Warren County road, they want to remind people about a potential resource for parents of a newborn. We're joined now by Kelly Garcia, the director of the state's Department of Health and Human Services. Director Garcia, this is kind of one of those things where you're not able to talk specifically about any involvement with this case in particular. So can you talk more broadly about how safe haven could be an option for some families?
Absolutely. So here at Health and Human Services, we want to meet families wherever they find themselves. And sometimes that's to strengthen and support a family, but sometimes we're meeting families when they're in full-scale crisis. And for more than 20 years in this state, we've had a safe haven law on the books. And in fact, the legislature expanded the ability for mothers to choose safe haven as an option last session. So women who find themselves in a space where they are unable to take care of their newly born baby up to 90 days post-birth can choose to call 911 if transportation is not something that they have arranged. They can go to any 24/7 hospital facility or healthcare facility, and they can also go to a fire department, a police department, or emergency management services, EMS. Those are all options for women, and we want women to know that when they choose safe haven, they choose a safe space for their baby, but they also choose a haven from prosecution.
What is the state's role then? So once a parent drops off the newborn, then where does the state take it from there?
So depending on where that newborn is, if they're at a hospital, they're immediately evaluated for healthcare, obviously. EMS or those other peace officers would also transport to a hospital, and then our agency is called. So that child then goes into an already registered online foster care provider, and all of the legal protections start to take shape as well. We initiate court, and I want to be clear also that mom or the authorized individual who turns over the baby will be asked some questions, but they don't have to give that information. So this process can be completely anonymous, and those court proceedings protect that parent as well.
But what is done to make sure that that adult is the legal guardian of that child to have that authorization to hand the child over?
So those emergency responders or healthcare practitioners are trained in the steps that it takes, and then those court proceedings continue to do that work. But again, everything is safeguarded, and that process is really there to ensure anonymity should that parent want to take that route.
This has been done, I believe, several dozen times since it started, right?
More than 58.
More than 58. And that going forward, then what happens when this happens? Do you essentially, as the parent, then sever any future, tie to that child? How does that work?
Correct. Ultimately, those court proceedings sever that relationship. And again, that's the space where, much like our child welfare proceedings, there is court involvement and oversight. But again, if the parent decides to take that anonymous route, that aspect is protected as well.
Perhaps a challenging question, but does the baby later on in life have the ability to track down a parent, or is that not an option?
If the parent chose this route with anonymity, then no. And definitely challenging, but in a space where a presentation of an incredibly challenging situation, that mom chooses a safe place for her baby and safety is ensured.
Just maybe a final thought here. Your agency, perhaps more than any other, deals with can deal with some of the toughest situations. When you read about a case like this, what is the impact on your organization?
Heavy day, really heavy day. I think, again, we as an agency want to be known as a safe and friendly place, even on your darkest days. There are options. And we want you to know that we're here, and we have a whole team of healthcare professionals first responders and peace officers who were there to assist us in this process. But it is absolutely an option, and one that we hope that this incredibly tragic story helps spread the word of this incredible program.
All right, Director Garcia, appreciate the time. Thank you.
Absolutely.
And just a reminder, just talking to Director Garcia does not imply any kind of previous relationship between DHS and this family in particular.